New York's Step Therapy Protections in the Law. Chapter 512, Laws 2016. Fully effective beginning January 1, 2018. What is step therapy? Step therapy is a policy that establishes a specific sequence in which prescription drugs for a specified medical condition are approved. It is a form of prior authorization that requires a patient take one drug, often less expensive, before he or she can step to a different drug, usually more expensive. What plans does the new law apply to? Insurers regulated under Article 32 or 43 or municipal cooperative health benefit plans certified under Article 47 of the insurance law. HMOs including Medicaid managed care plans and Child Health Plus. What plans does the law not apply to? ERISA self-insured plans. Medicaid fee-for-service. Medicare. What are obligations of insurer when establishing a step therapy protocol? Must use recognized, evidence-based and peer-reviewed clinical review criteria that also takes into account the needs of atypical patient populations and diagnoses. Must use recognized evidence-based and peer-reviewed clinical review criteria that are appropriate for insured and the insured's medical condition. Must make available to provider making override request the clinical review criteria and other clinical information used in making determination. An insurer or their agent must grant a step therapy protocol override request when the information including supporting rationale and documentation from the provider demonstrates that the drugs is contraindicated or will likely cause an adverse reaction by your physician, mental harm to the insurer, or the drug is expected to be ineffective based on the known clinical history and conditions of the insured and the insured's drug regimen, or the patient has tried the drug while under their current or previous health insurance or another drug in the same pharmacologic class or with the same mechanism of action and the drug was discontinued due to lack of efficacy or diminished effect or an adverse event, or these standards do not prevent the insurer from requiring the patient to try an AB-related generic equivalent prior to providing coverage for the equivalent brand-name drug. An insurer or their agent must grant a step therapy protocol override request when the information including supporting rationale and documentation from the provider demonstrates that the insured is stable on a drug selected by their provider for the condition under consideration, or the drug is not in the best interest of the patient because it will likely cause a significant barrier to the insured's adherence to or compliance with the insured's plan of care, will likely worsen a comorbid condition or will likely decrease the patient's ability to achieve or maintain reasonable functional ability in performing daily activities. These standards do not prevent the insurer from requiring the patient to try an AB-related generic equivalent prior to providing coverage for the equivalent brand-name drug. Timeframes for required review. Insurer must respond to the non-emergent requests within 72 hours. Insurer must respond to emergent requests within 24 hours. Defined as a medical condition that places the health of the patient in serious jeopardy without the drug prescribed by the provider. Immediate coverage of the drug is required once determination is made. Time frame begins to run upon receipt of all information including supporting rationale and documentation from prescriber. What happens if the insurer fails to respond within the time frame established in law? The appeal override request shall be granted. What if the patient's or physician's override request is denied? Patient has right to external appeal by an independent external appeals agent recognized by DFS. For more information concerning external appeal go to the following links.